things that podiatrists do also is to order x-rays to look at the bony structures of the foot. Usually we order them in a weight-bearing position like this one, where the foot's taking weight on the ground, to look at the joints, the amount of cartilage that remains between the joints, whether or not there are any abnormal sort of, for instance, like a bony spur or a piece of Achilles tendon having some bony infiltration into it. This x-ray, obviously you can see this is a pin here. This is a post-surgical foot where the first metatarsals had a pin through it. And so this is just a different view. This is also a weight-bearing view. And so when we look for things like arthritis, or when we're testing a foot, there may be a scenario where we can't move the joint. And that certainly is going to impact on what we would do, say with an orthotic for instance, what we might do to be able to either make the foot work differently or leave well alone. And so x-rays are a part of the arsenal as well that you can use to end up with a final diagnosis. Podiatrists now also order CAT scans, and so more and more information is available to create good diagnosis for your patient. You can order some pathology tests, and of course one of the largest ones that we see are fungus, either around the skin or within the toenails. Fungal nails are a really commonplace problem. And so we may take some cuttings of the nail, send it off to pathology, and for some treatments the government requires evidence that a fungus has actually been able to be grown from a cutting that you've taken of the nail before that particular treatment will come under the PBS program. And so for some treatments they are very expensive if you're paying for them as just a private patient. But if you can prove that fungus exists, for some of those medications, they then come under a much cheaper treatment range.
Shards of glass, splinters like rain. You could only feel your own pain.